So this brace is pretty snazzy. Can you explain the benefits of it?
Yeah. So what's great about this brace, a lot of them were very bulky in the past, right? They'd have these metal rods that were like 3 times the thickness of this, and we'd have it on both sides. And they were approaching the aspect of what we were looking for, of trying to open up a particular joint space, but not quite doing it. What I like about these now, it's much more low profile. It's comfier, they're lighter, and it's pretty easy to use. As you can see, there's numbers written here, so basically you just follow that pattern and you clip that in. But really where the benefit comes here is this hinge, right?
Yeah.
So there's a cushion here with this hinge, and this is where the hinge aspect is. Then you can alter this, right? And so with this, you're going to see that that hinge goes in like that, with the idea that this is pushing from the outside, thus opening this inside joint space to achieve what we were discussing before, of trying to unload that space. Now for you, we discussed that I want to try and stretch that MCL and try and give that meniscus a little bit more room to have its healing factor.
Yeah.
There's a lot of patients that I see, and I'd say the majority of my arthritic knee patients have some sort of bone marrow lesion in either their femur, their tibia, or both on that inside joint line.
Yeah.
And that is actually what's found to be a source of pain. There's been testing and evaluations of what that substance looked like when it lights up on MRI. Obviously, it's screaming out to us, I'm having a problem. What does that look like in there? And the people found that there were vascular channels that were connected with nerve that caused pain, right? And so if you can start to clear up that bony tissue, then you can start to actually heal where that pain source is coming from. Then a brace like this becomes critical for those patients, particularly if I'm hitting that bone marrow lesion, because it's really that pressure from that's causing those problems. So if I can open up that space and do whatever I can from the outside of the body to help assist in the biomechanics, then that helps my biological process.
So one question I had is, so I spoke with the rep from Synergy, which is where this comes from, and she showed me how to tighten it or loosen it a little. I think it was up here.
Right there.
And I wasn't quite sure because it was really, really hurting at first.
Yeah.
So she said, oh, well, let's get it totally neutral, which I think I do have it pretty neutral.
Yeah, it was
do
pretty
I?
neutral. Yeah, yeah.
And so then if I want to start, when I'm ready to start opening it up a little bit, how do I do that?
So you should have a tool.
I do.
And this is just a basic Allen wrench, so even if you don't have that, that's what you use. You go in there and you'll see that this will start going like that.
Okay.
Because that hinge will start to do this.
Yeah.
And that's what you're looking for. And it doesn't need to be dramatic. But I'd like to see if people can actually start to improve that angle.
Yeah.
And I don't need you to get to the very maximum of it. I just need it to get to an extent where you feel like, oh, okay, I'm feeling that pressure. And it feels like it's opening up that inside portion of the knee.
And then, so I'm 2 weeks out. When would you say it's time to open it a little more?
Probably next week.
Okay.